So coming to the what are the causative factors for the cancers, these tumors. So up to now, there is no exact causative factors for the cancer. For example, okay, if someone, okay, for one example is the smoking. For example, but if anybody is smoking, so overall smoking, all people are not going to get the cancer. Some people may chance to get, most of the people may chance to get, and others may not get. So there is not exact one causative factor for the cancers. So scientists believe that it is the interaction of many factors together to produce the cancer. It's a many factors. It's not only one factor. So that is the reason some people may chance to get the cancer who are exposing to the same causative factors, but they won't get the cancers. But who are getting the less exposure to the the risk factors may chance to get the cancer. So this depends upon the person to person vary, and also so many other factors also is together with it gives the other factors responsibilities and may chance to get the cancers. So these factors may be the genetics and also environmental, constitutional characteristics of the individuals. So it depends upon the person to persons and also genetic involvement and also environmental and constitutional characteristics. So it won't be same for the everyone. And also this diagnosis and treatment and prognosis for the child cancer different than the adult cancer. So many different type of the cancers are there. So it will be different to the adult cancer as well as the children cancer. So the diagnosis and treatment and also prognosis, so it will be totally different to the adult cancerous cells and also the children cancerous cells. As the main difference of the survival rate and the cause of the cancer. So overall 5-year survival rate for the children, the childhood cancer is about 80%. So they can survive until the 5 years is more than 80% of the children are going to survive. While the adults, the cancer survival rate will be in the 68%. So in the adults, so it is going to be a little bit percentage is going to be decreased. So the difference is that to be because of the childhood cancer is the most responsive to therapy, and also child can tolerate and more aggressive therapy compared to the adults and childhood cancerous. So who are going to get the childhood cancers. So the difference is thought to be because of the childhood cancers are more responsive to the treatment, and also adult cancers are a little bit less than the child cancers. If you see the childhood cancers often occurs is a benign in the stem cells, which are simple cell capable of producing other type of specialized cells that body needs. And also the childhood cancers are going to be respond easily to the treatments, but in the adult cells, so it becomes a cancerous, usually on epithelial cells. Epithelial cells lines the body cavities. So these epithelial cells are going to especially is located in the body cavities, such as in the body surface and regions. And also cancers occurs from the environmental exposures to these cells over time, because the body cavities are exposed to the prolonged time to the environmental exposures. So it may give the adult cancers. The adult cancers sometimes refer to the acquired for these regions. So that's the reasons. So these are going to be acquired type of the cancer. So because of the exposure. So what are the risk factors? So who are going to get these cancers is most commonly is exposed to so many factors, is not in the one particular causative factors. So such as the lifestyle factors. So in the lifestyle factors who are going to be exposed to the smoking is either active smoking or passive smoking. If the prolonged exposure to the smoking, it may chance to get the cancer. And also a high fat diet, especially the saturated fat, and also is nowadays many people are using so many chemical food as well as the so many toxic foods such as all the oil fried foods. So it may use many people are going to use the oil many times by using the frying the many food materials. So this because of the burning so much of oil many times, so it may use the chemicals producing. These chemicals may give chance to get the cancer. And also who are working in the chemical industries or who are exposed to the chemical products, so may chance to get the cancer. And also most children with the cancer, however, too young to have to who are having the children, childhood cancers also, who are exposing to these these materials, especially the smokings and also high fat diets, and also chemicals also, if prolonged time if exposed, childhood cancers also may chance to get because of these lifestyle factors. And also another factors are the family history. In case of any family history, any genetic defects, so if any family members got the history of the cancer, or may chance to spread to the genetics, like in the genes, it may spread to the children's. And also genetic plays an important role in the some childhood cancers. So that's the reason nowadays many childs also, the children are getting the cancer because of it may having the problem in the genetics. So that means who are already having the problem, so in the parents or maybe grandparents, so these genes may transmitted into the in the children, so they may chance to get the cancers. And also some other genetic disorders, especially is the Wiskott-Ehlers syndrome and also Beckwith-Wiedemann syndrome. So these are the most common disorders, are is related to the genetic immunodeficiency disorders. So these also may chance to give the cancers, especially in the childhood cancers. So these are also is going to give the extra growth of the tissues, and also most commonly they are going to enlargement of the big tongue you can observe who are having these syndromes. So these are some of the genetic disorders commonly you may chance to get cancer, childhood cancers. And also certain viruses. So these viruses may chance to increasing the risk factor for the development of the cancer. So these are such as the Epstein-Barr virus and also HIV virus. So because of the HIV, may chance to develop into the AIDS. So these are going to be interlinked, and also developing the childhood cancers such as the Hodgkin's and also non-Hodgkin's lymphoma. It's related to the lymphatic system, cancers may chance to get because of these virus, especially is a EBV and as Epstein-Barr virus and also HIV virus. Possibly the virus alter a cell in some way, so it's going to alter the cells. So because of this alteration, so it may chance to get the cancer in the childhood. And also in case of if they exposed to any environmental toxins such as the pesticides and also fertilizers, and the power lines have been researched for the direct link to the childhood cancers. So who are being exposed to the fertilizers and also pesticides, and also who are the high lines and also power lines, especially the high metals exposure, or maybe who are in case of if anybody get the treatment cancerous agents, if exposed to those medications also may chance to get these cancers. So there has been evidence of cancer occurrence among the non-related children in certain neighborhood or also in cities. So if anybody is if they are staying in exposed to chemicals or the strong pesticides or maybe fertilizers, who are just living near to any companies related to pesticides, may chance to expose to these chemicals will get the childhood cancers. And also this whether the prenatal or also infant exposed to these agents that causes the cancers. So if before the mother, for example, if the mother exposed to these chemicals such as the pesticides or fertilizers, also may affect the child and also may chance to get the cancer. So because before the prenatal as well as the postnatal, so if they exposed to these chemicals, so they may chance to get the cancer.